moving away from car damage and we're moving towards supercomputers. So to introduce the next topic, I want to ask you if you would believe me if I told you that the key to solving some of the most pressing problems comes down to a computer's ability to mimic reality. Over the past 60 years, we've seen incredible developments in computers and within supercomputing, specifically enabling very interesting use cases. This goes from predicting weather more accurately to governments using this to have elaborate safety plans for nuclear events, and also to simulating the functioning of the human brain. So the use cases are absolutely endless, and in the next session, we will focus on the power of supercomputing, specifically impacting healthcare. Ivan, over to you.
Hi everyone, welcome back to our presentation. You know that I'm already working in AI, but what I can add is I also work a lot with supercomputers, and especially we worked with the Meluxina supercomputer located in Luxembourg. It was really interesting to develop large-scale AI solution, especially when we're running out of power using classical computer. But first, let's go back in time and starting in 1929, when it was the first appearance of the term supercomputing in the newspaper New York World. Back in the day, it was not really a computer, but it was referring to tabulators. What are tabulators? It's only like old way of computing that was using punching cards to do a complex calculation. It was the first time the word supercomputing appeared in the news. Then, jump in the time, 1964 is the first release of the CDC 6600 that was sold for $9 million at the time, and it was the first computer really named supercomputer, and it was outperforming by a factor of 3 all its competitors. And to give you an idea, it was only 3 mega floating point operation per second. So to picture yourself, we put a scale at the bottom of the slide, and you will see that from now to 2023, today, we're going to add more zeros to these floating point operations. So I guess it's a good moment to define what supercomputers are, and it can be defined as computers, but with performance that can outscale every other computer of their time. And they're also especially designed to perform highly complex calculation. But I will talk of that a bit later. Let's go back to the timeline. In 1970, it's the beginning of the 10 years era called the Cray era. Cray is a company dedicated to supercomputing, and that has been recently acquired by HP, and it created a lot of innovation in this computer field. 20 years later, in 1990, this is the beginning of what we're calling the massive processing decade, with the democratization of the parallel processing. Indeed, back in the days, when people wanted to make computer more powerful, there was trying to make processors more powerful. Indeed, we were having only 8 processors in supercomputer at the time, and beginning of 1919, this from now, people are trying to put a lot of powerful processor, but in parallel, working together. And we've been from 8 processors to more than 1,000 of processor in the supercomputer. And I will talk also a bit about the architecture of supercomputer just after. Then in 2000, the terascale era started. And as you can see, we were at mega scale for the first one. And in the 2000, we are reaching the terascale. The supercomputer in 2004, the most powerful one, reached 35 teraflops. And by comparison, it's today equivalent to an high-end consumer-grade graphic card that you could buy for like $600, $1,000. Not that much, but it was the most powerful supercomputer at the time. And finally, at the date of today, we're starting the exascale supercomputing era with a supercomputer called Frontier, hosted in the US, that has just reached the petascale computing power. And you can see, the exascale for the frontier, and we are like mostly all supercomputers now are reaching the petascale, and this frontier reach the exascale. So you can see it's like at the very, very left of this floating point operation scale, and it's said to be like the exascale era for the 10 years coming. Now, most of the computers are reaching petascale, and you can find many of them everywhere. I told to you about the one that we have in Luxembourg, but there are a lot also in Europe. And the problem with supercomputer, especially when you think about it, is that you may think it's really specific for researchers or university, but more and more, supercomputers are also used by industries to create complex calculation or complex simulation. And one European Union initiative is also working on the fact to create a sort of supercomputing as a service solution, where you could yourself, as a professional, reach and use supercomputing power whenever in Europe, using just a simple web app that you could find on the cloud that you know. This would be called HPC as a service or supercomputing as a service. Now let's deep dive into the technical part, and let's see how modern supercomputers are built. This is really important to understand that all the components that you will see here are really especially built for supercomputers, and they are all linked together with special links that are really made to be the fastest ones. So, as I told you just before, back in the days, supercomputers were like the computer one that you're seeing on the screen. Some CPU with some cores and some shared memory, only one, simple. And they were trying to make it the most powerful. And starting this 1990s era, so beginning the massive scale and massive parallel era, they started to make CPUs and computer work together in parallel with interconnection link. I'm not going to go too much in the detail, but you have many ways of putting different CPUs, different computer to work in parallel. Here, it's just one view that, for example, you would have like some memories that would be shared in one computer, but not between computers. And you would have like the data, the disk that would be shared between the computer. And by doing some different algorithms that are really designed for this supercomputing paradigm, you would be able to put the workload on different nodes. So the computer one will just work on one part of the data, the computer two on another part, and at the end, one computer will be in charge of putting all the data together. That allows to have like really fast computation. I also want to have a quick word because I told you a bit about high performance computing, also known as HPC. What would be the difference? Back in the days, HPC was not known, but now you will hear a lot about it, and it's referring to the field, so the field of high performance computing, and now it's also referring to this parallelization parallel, so making computer work in parallel together. Nowadays, we can say because supercomputers are using this parallel architecture, that it can be used interchangeably. Now, we can apply this supercomputer use case at the healthcare domain. Yeah. Why we want to talk about the healthcare? Because, as you may know, we have a lot of medical data. It can come from everywhere, from the hospital where you're doing some analysis. It can also come from wearables that you might wear. And these data are stored for a lot of people for a long period of time. So hospital and are hosting a lot of data, but this data is usually not really easy to retrieve. I've been working with some companies that were working with hospital, and most of the hospital were not able to use the data that they were hosting for their own researchers because they were not, firstly, not able to reach this data, and second point, they were not able to process the data if they were able to reach it because it was too large, unstructured data, really hard to process. So supercomputer can really help in that field because it would provide power to analyze unstructured data at a scale of big data. So that would be the first point why healthcare needs AI and especially supercomputer. Also, as you may have seen in the recent news, but with generative AI models such as GPT-3, GPT-4, but models are becoming larger and larger. GPT-3 is reaching 175 billion parameters, and it has been trained over a long time on supercomputers, and it costs a lot of money. So it's not available to everyone. And because of that, if supercomputers are becoming more accessible, the healthcare domain will be able to develop AI models that could help the healthcare domain. And I will talk about the use cases just after, by simply allowing everyone to play with the data and to come with innovative solutions. And finally, what's the outcome of this is just to improve the cares. If you have better diagnosis, if you have personalized treatment, because we're able to create personalized drugs for your special disease, it will just make life easier. Now, let's deep dive into some specific use cases. And I want to start with one that I find really interesting, is the creation of the synthetic brain images. As you may know, we're not really aware of all the function on how the brain functions, sorry. So researchers are working on finding how everything is working, and is it related to genes, genres, ages, what disease is impacting which region of the brain. And it's really hard because they do not have access to a lot of data, because you need to have the picture of your brain that we are going to call MRI scans. You need to go to a specialist, it takes this picture, it's not easy to process, and so on and so on. So to enable researchers to do more extensive research, they decided to use AI models to create synthetic images. So they would use a training base of real MRI scans to create fake one that would able to replicate a specific genes of people, specific ages, if it was a specific disease, and so on. So it would help reducing like the time to access to the data, and then of course to accelerate the research in that field. Of course, it may contain inaccuracies, because if you created synthetic images, and you may have seen this in the recent model on the news, Midjourney, sometimes they're having some difficulties to create, for example, the hands, and it can be the same for brain images. Some parts will be maybe not the most accurate ones. Now, I want to talk about the drug development research. We have been known about that with the COVID, because COVID vaccine came out in like 1.5 years, and before, vaccines were taking 10 years to be processed. It was not only about because of AI, but also. And what AI could help in that field is because it will test a lot of different possibilities of drugs and check if it's working for the disease without having to put it on the market, create clinical trials that can last for a really long time. And it will for sure speed up the identification of new drugs. And because you're taking less time to identify these drugs, it will cost less. You would have also different use cases, for example, the organ diagnosis. By using different captors, you will be able to create models that, with the information from these captors, would be able to know if, for example, the heart is working well with mechanical properties, the elasticity, the relaxation, and so on. And with this model, you will be able to have like an early stage diagnosis, and you will be able to go to your doctor when you will need to. And finally, it can also help identifying mental health problem by the creation of a lot of different AI models, NLP models, more or less, that would be able to consider the answer to a lot of different questions and to identify people at risk. To conclude on this point, I want to see that AI and especially supercomputer in the healthcare domain could be really useful, and it will also accelerate the research. if you have any question.
Thanks a lot. Actually, Ivan, there is a question in the chat. I will read it to you and we can answer all together as a team. We have Nicola as well here with us. So the question is, what would be the difference between a supercomputer and a distributed computing system, for example, on the cloud? So yeah, give us your thoughts on that.
I told a bit about the difference between supercomputer and computer on the cloud, and the difference would be that the supercomputer is like a single powerful machine located at one point, and it's really especially designed for high-speed computation, really like especially designed for that. While the distributed computing in the cloud, it involves many computers and they are connected over the internet, but not with this fast interconnection link that I've shown you in the diagram. And it's more made to provide on-demand computing resources. So you would have access to one node that's located there, one node that could be located in Germany, and they would be linked over the internet. Whereas really, supercomputing is like a single machine, and it's really located in the same physical location. Whereas the distributed computing is located on the cloud, so at different places over the world.
Thanks a lot. I don't know, Nicola, if you have anything to add to that, but I think we answered the question quite well. As there has not been any other questions in the chat, this brings us to the end of Luxembourg's session. So we want to join everybody we want to thank everybody for joining, not join everybody for thanking. We want to thank everybody for joining our session this last hour, where we really focus on multiple topics. We started with satellite images, we moved towards car damage detection. For the insurance sector, we moved towards how this can also be applied actually with regards to fixing the vehicles. And we've ended off focusing on supercomputing, specifically applied to the medical sector. With this, the global 24-hour marathon continues, and I am happy to hand over the session to our neighboring country, Germany. Please note that you can stay on the link throughout the rest of the day. There's extremely interesting topics on Germany's agenda today as well. They're touching upon the future of autonomous driving, for instance, as well as generative AI, which is a really hot topic. And I'm sure that they'll tell you more about this, but thanks a lot for being here, and over to you, Germany.